Hey friends, I'm Dr. Molly Brinkman. I'm a small animal veterinarian near Nashville, Tennessee. And this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. So welcome to the Dr. Molly Says podcast. If you're watching, look around. I'm in a blank room. In a blank room you've never seen before. In a chair you do recognize. So if you missed my story this week, we have moved to the podcast studio. If you're new here, we started this podcast about a year ago, and I set up shop in my parents' barn, in the loft of the barn, which in my mind was a great idea. But in reality, it was not, because the barn is not weather controlled, temperature controlled. So it was really cold in the winter and really hot in the summer because we're in Tennessee. And so we quickly realized the barn's not going to work. So I have been recording in my house, and as of today, I now have a space to record this inside of a building, a very important building that I'm going to tease. I will tell you about more soon. So anyway, right now, it's just me in this pink chair that I love in this blank room. We're going to make it cute in here. We're going to make it a podcast studio. But for right now, it's a blank room, but it's okay. So thank you for being willing to listen to me or watch me talk in a chair in a blank room. So today it's the week of Christmas. So if you celebrate Christmas like I do, it's a very exciting week. This is going to go live tomorrow, and tomorrow will be Christmas Eve. So if you're watching or listening to this on Christmas Eve, Merry almost Christmas, and whatever else you celebrate this time of year, if you celebrate a holiday. So today, because it's Christmas, wanted to do an easy episode. I'm just going to answer some questions. I have sent question requests over the last few weeks periodically. So I have several questions from you all, from listeners, followers, that we're just going to answer off the cuff. And if you have a question that you would like to submit, you can always do that to my page, Dr. Molly Says, or the podcast page, Dr. Molly Says Pod. So anyway, I hope you're all surviving and thriving in this holiday season. I'm a parent of humans also, if you didn't know that. And we've had a sick kiddo this weekend. She's on the mend, sister, as I call her on my page. She's 4 and hilarious. And we hate when our kids are sick, right? Animal or human. So very, very thankful she is better, and really hoping that my 6-year-old does not now also get sick. So far, he's okay, but I'm also waiting for myself to go down, but I can handle that better than my kids being sick. So let's get into some questions. Okay. And I don't have a hot take, because these questions will be the hot take. Lizzie M24 said, or requested, prescription food for allergies, good route or better to find a less processed food like freeze-dried? This is a very good question. And this is kind of a can of worms we're opening here. So I'm going to try to be as quick as possible. So when I talk to clients about dogs or cats that we suspect have allergies, what I break down to clients is the 3 most common reasons for allergies are going to be flea allergy, food allergy, and environmental allergy. And under the environmental allergy column, we're talking about allergic to all kinds of things in the environment: dust, pollen, grass, trees, dander. So allergic to cats or allergic to dogs. And so environmental allergens is actually a very big category. And the vast majority of dogs and cats who have allergies that are making them itchy have environmental allergies. Now, if they're not on flea prevention, flea allergy becomes a very big possibility. But if they're on good prevention, then most of the time, those pets have environmental allergies. Then we talk about food. A lot of pet owners want to make their pets' allergies about food. And I understand, because humans have food allergies, and so that seems simpler. And I've talked about this in an episode before. But food allergies, they exist. They're not as common. What I do see and other vets agree that we do probably have some patients that have some sensitivities to certain foods, or certain proteins especially can exacerbate underlying allergies to environmental things. So dogs and cats that have environmental allergies, they're already in this kind of inflammatory state. And so certain foods or proteins can exacerbate that inflammation, if that makes sense. Chicken and beef are two very common ones for that. And so when I am having a conversation with a client about their dog, especially, or their cat that has allergies, if we're not pursuing an actual diet trial where we put them on a specific food to see if that fixes their issues and tells us they probably do have a food allergy, we're talking about managing environmental allergies, right? Either going to a dermatologist to do testing for those environmental allergies and immunotherapy to try to treat them, or we're reaching for medications I have in my clinic to try to manage the itch and the inflammation in response to those allergens. Okay, so that's the big picture conversation. Now, in several of those cases, I'm going to talk to my clients about changing diets. We do that for one of two reasons. Number one, if I suspect that that patient might have a true food allergy, that's when I'm going to talk to that client about switching their pet to a prescription diet. Prescription dog and cat foods are very, very meticulously created foods. They are formulated by veterinary nutritionists. They are incredibly expensive to develop and make, and they are tailored to that specific disease. And whatever disease that prescription food is helping with determines what happens in the food. But when we talk about foods that are made for dogs with allergies, there's a whole range. So there are prescription foods that use novel proteins to make the diet. So meat sources that your dog probably hasn't seen before, or cat. So kangaroo, venison sometimes. There's one with alligator, I think. So proteins that your pet probably hasn't seen before. Those are called novel protein diets. And those are used sometimes for diet trials. Because if we think a pet might be allergic to beef or chicken, that's in everything, right? And so we put them on a protein that doesn't have any of that in it. And prescription diets, the reason a lot of veterinarians are going to recommend those is because we know what these companies do and how they make them. What that food says is in it is all that's in it. In a lot of other diets and over-the-counter foods, you're going to have cross-contamination. No matter what the bag says, you're going to have cross-contamination because those foods are made with other foods. But when we talk about a prescription food, those foods, what they say is in it is definitely only what is in it. And so we know if we're feeding a novel protein prescription diet, that's all that pet is going to be eating. And so we can trust it. There are other prescription diets for allergies. Some of them contain different formulations that are shown to decrease inflammation in the skin associated with allergies. They may include things like extra omegas, different ingredients that can help with inflammation in the skin. And then we talk about hydrolyzed diets. And these are very, very specially formulated foods. They go through this very scientific process called hydrolyzation, where they take that original protein and food and they break it down into such small particles, basically, that the immune system in the gut doesn't recognize it anymore. And that's a very layman's term way of explaining what hydrolyzed foods are. But that's why we often recommend those foods when we're doing a diet trial to see if a dog or a cat is allergic to those foods. So I hope that makes sense. So that's why often your veterinarian is going to recommend those prescription foods. It's not because they get a kickback from the food companies. It's not because, a big food company paid for their vet school. It's because they know that those diets actually do what they say they're going to do. And they're very, very particularly formulated. So this person asked, is that better, a good route, or is it better to find a less processed food? And that opens this whole conversation about what is actually wrong with kibble. Is there something wrong with the processing involved in creating kibble? And this is something I've talked about before. We can talk about more later. But it is okay to use a prescription food. It is very good to use a prescription food, especially if your veterinarian thinks it's warranted. it will likely help your pet. And your vet has a very good reason usually for prescribing that. And you are not harming your pet in any way by feeding up prescription food. So I will say there are situations, especially in dogs with allergies, where I will talk to my clients about trying a fresh, whole cooked food instead of a kibble, not because I think the kibble is causing the allergy, but for a myriad of reasons, it just is something we want to try. And I do have patients that do well on those. One of the reasons is sometimes we do a home cooked recipe. And so the owner can actually control the ingredients completely that are going in the food. And so that's one way that can help. But yeah, both are good options for certain situations. But the main thing I wanted to get across in this answer is that there are many prescription foods that are very, very important and very, very good for your pet. And your vet is recommending them for a reason. Okay, our next question is from Fanamosa, who is, I recognize this handle because this is a follower that's been around a long while with me. Hello. Okay, the next question is, treatment for lipid deposits in rough collie eyes, please. Okay, great question. I wish I had one of my ophthalmologist friends here with me. Actually, Dr. Sigmund is about to come by here and say hi. Maybe we'll get his input. But here's what I do know about this question. So if you don't know what this person is talking about, there's a condition that dogs can have called corneal lipid dystrophy. Okay. So in the eye, if you don't know this about me, I love ophthalmology. I think eyes are like the coolest thing ever. If I went back and did a residency, that's probably what I would do. But anyway, when we say the word dystrophy, we're talking about eyes in the cornea. That means something genetic that happens in the cornea that isn't because of like a disease process. It's just like a genetic thing that happens. And so or it's just like a abnormality that isn't necessarily a problem. So collies are one breed that is predisposed to this certain kind of corneal dystrophy called lipid dystrophy. And what that means is their bodies deposit lipid or like fat molecules within their cornea, so the outer surface of their eye. And that can become something that we see. So we see this little sort of like milky deposit on the surface of their eye, and it's actually within the surface of their eye, and it can be like this round kind of bubble looking thing, and it can show up pretty young. We can start to see them middle age, and they can look a little bit alarming, like, oh, what is that? Because it can be pretty obvious. But usually lipid dystrophy is not a pathologic problem. Unless they get really, really big, they're not going to cause vision issues, and unless they're caused by something else, they shouldn't be causing inflammation or pain or discomfort in the eye. And so usually we don't have a good way to treat them because it's just something their body is doing. But usually we don't need to, is the good news. I know that I think sometimes ophthalmologists may talk about surgery to remove them if they just get so big that they're causing a problem. But I think that can also have complications. So the short answer is lipid dystrophy in dogs, as long as it's not caused by some other kind of inflammatory process, are not usually a problem and not something that we need to treat. But collies are a breed that we see that in more often. So if you have a collie or a breed like that and you suddenly see these like white things on their eyes, that may be all it is. You should definitely have your vet check it out. But there's a good chance that it's just a lipid dystrophy and not something that we need to worry about. So that was an easy question. All right, next question. Nick 2 Pups said, tick fever management in dogs. Does it keep coming back after one infection with no more bites? Okay, this is also a very big topic, this question, but we'll get into it. So here we are in Tennessee where we have all the bugs and all the ticks, right? And our ticks carry a lot of different diseases. And this is true in a lot of parts of the country. Different regions will have different diseases that their ticks typically carry. So here in the Southeast in Tennessee, we do see several tick-borne diseases, okay? If your vet talks to you about a possible tick-borne disease, it could be a lot of different things. So ehrlichiosis is one. Lyme disease is one, Borrelia, anaplasma. We also see cases of Rocky Mountain spotted fever, and there are more. And so when someone says tick fever, usually this just means a dog that has some type of illness. They do often have a fever, and we suspect or we diagnose the original cause of that is some type of tick-borne disease. When we see patients who are generally ill, they have a fever, we do kind of regular workup, blood work, x-rays, things like that to try to figure out what's wrong, and we're not really getting anywhere. Tick-borne disease is definitely something we think about, especially somewhere like here where we see a lot of tick bites and our ticks carry diseases. And we do sometimes come to a diagnosis. We send out a tick titer panel. We get a positive result for a certain specific tick-borne disease. Sometimes we don't. And a lot of times we treat those patients with an antibiotic called doxycycline, and that takes care of a lot of those diseases. The question is, does the disease, the fever, keep coming back after one infection with no more bites? So no more like tick bites. And I would say that if we properly treat an infection with some type of tick-borne disease, usually that takes care of the actual infection that makes them sick, and that shouldn't come back. And so could they technically have another disease from a different tick bite that shows up around the same time? I guess that's possible. But usually if we properly treat that disease, it's not going to come back. And then if we don't have any more tick bites, that pet should have some protection against that disease moving forward because their immune system has created antibodies against it. We will see those patients pop up positive on what's called a 4DX test. So a lot of times your vet's office runs a heartworm test that also includes testing for antibodies to some tick-borne diseases. Not other tick-borne diseases, because heartworm disease is carried by mosquitoes, and you know that if you listen to this podcast. But tick-borne diseases, we do have a test that's included with the heartworm test for that. And so that is detecting antibodies. So that doesn't tell us that your dog has an active infection with that disease. Most of those are going to pick up on Ehrlichia, anaplasma, and Lyme disease. And so if we have a 4DX pop positive, we'll say, or SNAP positive, that just tells us that your dog has hosted an immune response to one of those diseases. They have enough antibodies circulating in their system to make that go positive. And if they're not ill at the time, they probably don't have active infection with it. They just have been exposed to it. So their immune system remembers what that disease looks like, and they will maybe have some protection if they come into contact with it later. Once those antibody levels are high enough that it makes the SNAP test positive, they're probably going to stay high enough to do that for a few years. So I always tell people that SNAP test is going to be positive for a while. And it's just a really great reminder to give your dogs and your cats flea and tick prevention, especially in places like here in Tennessee, where we do see ticks all year round. It is going to be 65 degrees on Christmas this week here. And so there are definitely ticks out and about when the temperature is like that. So you just never know in a climate like this when we're going to have warm weather and ticks can pop up and fleas. So that is why we do recommend year-round flea and tick prevention here in Tennessee and a lot of places in the U.S. Okay, great question. Next question is from Evie's Photos, who is a client of mine. She has the most adorable rescued standard poodle named Annie. Her question, which I love, is how can dog owners know if a supplement is too much or not doing well for their dog? Love this question for a lot of reasons. One reason is because I'm a veterinarian who very much believes that there are several supplements that have a great place in taking care of our pets. Okay, not all veterinarians are very pro supplement. I am very pro some supplements, but I also feel very strongly that we need to remember that supplements are just that. They are intended to supplement medical care of our pets. And so they can be incorporated in our treatment plans. And I think they definitely can help with certain diseases and conditions. And there are some things that they can actually treat. But I get nervous about supplements sometimes because I do think sometimes people want to replace medical care with supplements. And in most cases, that's just not what they're intended for. And so if you're a dog owner or a cat owner who feels confused about supplements, I feel you, because there are so many options out there. There are ads coming at you. Some of those ads come from me. I only make ads about supplements that I truly think are a very good idea. But it gets confusing, and it's tempting to try a lot of different things. In most cases, there's not a lot of harm in trying supplements. Some can be harmful. Combinations of some can be harmful. But the problem is, one, if you're using them in place of medical care that your pet should be getting, or two, you're spending all your money on all these supplements, money that you should only be spending on medical care or food or whatever for your pet. And so you just have to be careful about that. You have to be, I would talk to your vet about, hey, if I wanted to put my dog on a couple of supplements, what would you choose? Or what category of supplements would you choose? There are definitely some supplements that don't, sit well with certain pets. They can have GI sensitivity to them. And so if you're giving your pet a supplement and it's causing GI upset, obviously you're going to want to stop that. If you're using a supplement and you don't see it making a difference in what you're trying to help with, I would definitely chat with your vet about that, ask them if there's a better option. If you're using a supplement and you're not sure, how high quality it is, I would definitely see, are there veterinarians that are talking about this supplement? Does it have the NASC seal on it that can tell us that it's a good high quality supplement? And if it's for dental health, I really like for dental products to have the VOHC, they be on the VOHC list. So that's the Veterinary Oral Health Council. And that just tells us that those products can actually do something. If they're not on that list, it doesn't mean they're bad. But if they are on the list, that veterinarians or this VOHC have looked at this product and have basically given it the stamp of this is going to actually do something for your pet. And then NASC just evaluates for quality and quality control in those products. So that's how you know if a supplement is too much or not doing well. It's either causing some type of problem like GI upset, or you're not seeing a lot of results. And I would definitely chat with your vet about what supplements you might want to prioritize for your pets, because they're not all bad. Some of them are very, very, very good. And if you asked me what are my top 5 category of supplements that I think actually help pets a lot, no one asked, but I'm going to answer it. I would say omega-3, omega-6 supplementation. So fish oil supplements are very, very good. And omegas, there's a lot of different great options. So omegas are one. Joint supplements, another really important category that I think so many dogs and cats should be on. There are a lot of different ingredients nowadays that are in joint supplements, and there are benefits to a lot of them. So I won't get into all of that. Glucosamine chondroitin has been in joint supplements for a long time. I'm a fan of it. There's newer compounds and ingredients like green-lipped mussel, UC2, UHC, I can't remember what it's called. This is off the cuff. And then eggshell membrane. There's a few. So joint supplements, omega supplements, probiotics. Now, not all probiotics are created equally, but I think everybody on God's green earth could use a probiotic. So probiotics for sure. There are supplements now for healthier aging in our pets that include NAD+, and that is one that I really am a big fan of. And so that's 4. And then my 5th would be probably supplements. Oh gosh, how do I pick a 5th one? Fish oil, joint, probiotics, NAD+, and I don't know. Stay tuned. Let me think about it. I'll get back to it. There's 4. Okay, next question. When will my puppy be fully grown? 11 months and still growing, 75 pounds, mystery mutt. This person is KT Doyle 889. Okay, also great question. So our dogs grow, and cats physically grow until their growth plates close. Okay. And those are these tiny little gaps at the end of their bones near their joints that close as they grow, right? And I would say that so this question may have to do with, there's a lot of people talking about the age that we spay and neuter our pets, and some of that has to do with their growing and the closing of their growth plates. And I have clients who are like, my breeder told me not to spay or neuter my dog until their growth plates are closed. And their growth plates are not going to be closed until they're 2. And I love that people are thinking about these things. So when growth plates close is different for every dog. The size of the dog largely determines that. So the smaller the dog, the younger they are when their growth plates close. In giant breed dogs, their growth plates often are not going to close until like 18 to 24 months. And so that's why in a lot of those dogs, we're waiting until the age of 2 to spay and neuter them. That's part of the reason. And so when clients ask me though, when is my dog going to quit growing, like getting bigger, which I think is what this person is really asking. So giant breed dogs can get slightly bigger until they're 2, but most dogs are going to become like as big as they are going to be around the age of 1. So they can fill out after that and they can gain weight, but usually their frame is as big as it's going to be between like 12 to 18 months. Good question. And people always ask me, like, how big is my dog going to be when I see them as puppies? And if they're mixed breed dogs, I'm like, I don't know. I don't know. A lot of like poodle mixes, people want to know how big are they going to be when they're, 10 weeks old. And I'm like, I don't know. How big are their parents? That still doesn't really tell me. So one thing some vets will say is when they're about 4 months old, they're probably about 40% of their body weight. Which is like a fine guess. So that's kind of like a rough estimate you can go by. Okay, last question. And this one is another can of worms that I want to start talking about. So this question comes from Lewin Lacey. I don't know if that's how I say it, but she said, tips for finding a holistic vet you can trust. Okay, let's talk about this. So there's been some chatter in the veterinary online space about holistic veterinary care, traditional Western veterinary care. There are veterinarians online who practice holistic medicine or alternative medicine or Eastern medicine, whatever you want to call it. And an integrative medicine, which is a combination of traditional Western medicine and Eastern medicine, which, by the way, a lot of Eastern medicine practices have been around way longer than Western ones. So they should probably be called traditional. But anyway, there's just a lot of chatter in the vet space about this. There are some veterinarians who say they practice holistic medicine and they're on one far end of the spectrum. And they're on their platforms spewing a lot of information and misinformation and saying things that are ridiculous and harmful and dangerous for your pets. And they're one extreme. And then there are veterinarians on the other extreme who are saying things like all alternative medicine is wrong and not backed by any science and completely just irrelevant. And that's the other side of the spectrum. And I don't agree with that side of the spectrum either. And so the answer for most things is in the middle, right? And I have a lot of friends who practice integrative medicine. So they integrate Western and Eastern medicine, and it's a beautiful thing. And there are a lot of modalities to treat diseases that can be helpful. And I very much believe that both sides of this kind of conversation can be good and helpful, and we would get so much further if we just work together, which is the beauty of integrative medicine, right? There is a lot more research when it comes to Western medicinal treatments and therapies, just because that's the nature of that camp. And that's good. And that tells us what works and what doesn't work and what we should do for certain things. And in Eastern medicine, a lot of some of the treatments and modalities don't have as much research behind them. Things like acupuncture. Acupuncture is a really great treatment modality. It's a great supplemental treatment modality to be used with other things that we do in Western medicine. So if someone asks me, how do I find a good holistic vet? I guess my advice would be if you would like to find, my advice would be find a really great integrative veterinarian, a veterinarian who respects and uses Western medicine when it's appropriate, and also is very familiar with Eastern alternative medicine and is able to integrate both of those together. Because when you do that, I do think you can have really great outcomes, especially when it comes to pain management and other like degenerative diseases that really require a lot of work to keep pets comfortable. And so I would find a veterinarian who isn't out there saying, don't vaccinate your dog or don't use heartworm prevention, but is comfortable with alternative medicine and integrates that into their practice. Extremes are usually not the answer, right? And I would also stay away from traditional veterinarians who completely discount anything alternative, because I think they're also missing out on a whole world of things that we can use and employ to make our patients better and feel better and more comfortable. So we will definitely talk about this in entire episodes, but that's my answer to that is, if you're frustrated with a more Western medicine traditional vet, and you go looking for a holistic vet who's on the other end of the spectrum and it just completely discounts everything that we do and say, that's probably not the way to go. But someone that integrates both is a really, really great option. Okay, those are all the questions I'm answering today. I'm going to go because it is the week of Christmas and tomorrow's Christmas Eve and I got to go wrap presents. But I hope you all are having a wonderful time with family this week, whatever you're celebrating. And we are going to be heading into the new year next week. So if you're not following, make sure you do. Dr. Molly Says is my page. Dr. Molly Says Pod is the podcast page. Send us questions if you have them. And I will see you next week on the Dr. Molly Says podcast.